This has been a year unlike any other in American history. The world is in the midst of a deadly pandemic that has affected millions of Americans and killed hundreds of thousands. Meanwhile, the United States is finally grappling with centuries of systematic racism and oppression. And there is a new awareness and is also revulsion at the fact that the treatment of George Floyd, Ahmaud Arbery, Sandra Bland, Breonna Taylor, and so many more is not the exception to the rule. It is the rule. It is now up to us to ensure that awareness leads to change. It is a painful period in our history, but we as Americans, particularly Black Americans, have the resolve, the perseverance, and grace to emerge stronger, healthier, and safer. But it will take political leadership to make that change a reality. Thankfully, we have a president and vice president-elect who have at least pledged to repair the racial damage in our country. I've been traveling the country from the primaries through Election Day. We all remember the turning point in this election, South Carolina in late February, when Black voters used their voices and chose Joe Biden as the Democratic nominee for president. We announced to the world that Biden is our best chance at stemming the inequity that has plagued us for generations. The fight started in February and continued to November when Joe Biden was chosen as the 46th President of the United States. During the election and to this day, in talking to voters, one specific issue keeps emerging as a key concern: access to health care. COVID-19 has emphasized the gaps in health care access between Black people and the rest of America. We are being hospitalized at almost 5 times the rate of white people and dying twice as much due to COVID-19. Prenatal and maternal health care is in a similar crisis. Black mothers are 3 to 4 times more likely to die during pregnancy or childbirth than white mothers. And Black people are more likely to be made homeless by surprise medical bills that their insurance companies refuse to cover. This surprise billing, where patients are subjected to, quote, out-of-network care, and then told to pay the massive costs out of their own pockets, is devastating our community. What is the common thread between these Black health care crises? Insurance companies keeping all of their riches and getting rich, and we keep getting our claims denied. Insurers keep their networks as small as possible, focusing on the most profitable care and leaving our communities poorer, sicker, and destitute. Many politicians in Washington have ignored or do not understand these issues. The Congressional Black Caucus, meanwhile, has consistently led the fight. The CBC, with key leadership from members like Representative Karen Bass and Representative J.K. Butterfield and Representative Terry Sewell, has pledged to hold insurance companies accountable while expanding access to health care in the Black community. If we hold the insurers accountable, we can reverse the trend of shuttered hospitals in urban and rural communities, give people the care they need, and break the cycle of health care related poverty. We look to our political representatives to follow the lead of the CBC and get this done. It is our generation's most crucial fight. I look forward to working with President-elect Biden and anyone in Washington who is willing to take on big insurance, expand access to care, and end the crisis and end this crushing cycle of medical debt. Together, we can change the outcome.